Hello, welcome. Thank you for tuning in. This is Patrina Pellet. I'm the creator of Medical Affairs Strategy Hacks. I have an amazing guest episode for you today. I'm joined by Kirk Shepard, who, if you don't know him yet, you will soon learn why he is considered to be one of the best communicators in medical affairs. He is really, really good at building relationships. A couple months ago, I saw Kirk give a talk on how to build stronger relationships with your cross-functional partners. And he had this amazing tip that has stuck with me ever since about not trying to own everything. So Kirk, thank you so much for being here. I'm going to turn it over to you now.
Well, thank you so much, Katrina. I'm really happy to be here. I've always enjoyed your strategy hack, so it's a real pleasure to be here. And it's funny how you remembered that as the subject of the talk. That wasn't the subject of the whole talk, but that was a point that you pulled out. And a couple of people did come to me about it also. And what that subject was we've got a lot to do in medical affairs. There's a lot we want to do, but there's a way of talking to cross-functional staff that you should always remember. And I think one is communicate as a partner. I mean, pharma now is all about partnership, partnership, partnership. All the changes that occurred, we can't do it alone in silos. We have to have a good partnership. And so what does that mean, communicating as a partner? Two-way street. Listen to understand, because with increased understanding comes increased collaboration. I know what you're about. You know what I'm about. And then the other way, besides listening to them, define what you can do as medical affairs. Not everybody knows that. The definition of medical affairs varies somewhat between companies. So I have to admit, I carry around a slide of our pillars. And if I have to pull it out, I will, to show this is what we do in medical affairs, and this is what we have to offer. And somebody goes, okay, Kirk, I've seen that before. But it has helped me because it's kind of branded in their mind now, the pillars of what medical affairs can do. And the roof of the pillars is all about patients and patient outcomes. So with that, then, when you go in to talk to somebody, have a strategy and talk about perhaps a gap you see in the process, a way you can work better together. And when you do decide on something that's amiss, and let's take, for an example, we don't have a data gap analysis process at our company. And that was not this company, but the one I worked for before. Just don't go in and say, well, we're ready to start a data gap analysis. Are you with us? No, go in and say, get their understanding of that gap also, and then say to them, let's do this together. Medical affairs will appreciate your partnership and what you have to bring to the table. I don't want to do it alone. I'm sure you don't either. We know it should be done. Let's do it together. And the worst thing someone can say, and I've heard this say, even my staff, we've got to own this. This is medical affairs. We're going to own this. I always look at
deep voice too, right?
Yeah, the deep voice. Yes, yes. Even with the women, it's always a deep voice. We got to own this. You don't own anything. I always tell them, we own things together with our partners, and that's not something we should have as a part of our phraseology. So to us, it's about partnering. Let's do things together, work together, and then lastly, give credit and recognize those partners. Not just come out and say, well, medical affairs did this with maybe the help of clinical development or whoever, but give them credit, put them up front, and you'll get far more done. People begin to trust you, and they'll realize that what you're bringing to the table is something that they can partner with you on.
Yes.
That was the part of that lecture. Now, do you want to give me the rest of the lecture? I can give you the other 45 minutes.
Yeah. Can you guys stay on this a little bit longer? He's not done yet.
Yeah, that's right.
Yeah. Thank
Some
you.
other time.
Yeah.
Kirk. Yeah.
Thank you so much, Kirk. That was amazing. I love that. Thinking about, I'm not the boss of this, or I don't own this. We're a partnership. We're a team. We're doing this together. And at the end of the day, this is what's going to help create better outcomes for patients.
Exactly. And that's what it's all about.
Yeah. All right. Thank you so much. And thanks for everyone that tuned in. If you haven't checked out my new website on medicalaffairsvalue.com, be sure to check that out. I've got a ton of great tools and resources. You can also subscribe to my newsletter to get notified of new hacks like this amazing one that Kirk just had as they become available. Thanks again, Kirk, and see you all soon.
Pleasure.